Hello,
Oh, hi.
my name is Brad. I'm a pharmacist here. How are you?
Oh, not too bad. I'm Claire Nichols.
Claire Nichols?
Yes, I
Okay.
just wonder if someone would know what to do. I would like to know what to use for my cut on my foot.
Oh, you have a cut on your foot.
Yes.
Okay. Just before we delve into that, was there anything else you were interested in talking about today?
No, it's just this
That's
cut
just
that
the
is
cut,
worrying
okay.
me. Yeah.
Okay. Just so I make sure I understand everything about you, I'm going to ask you a few questions about your medical history. Is that okay to go over that prior to that?
Yeah.
Okay. Probably take about 15 minutes as well. You're okay
I
to,
have the time.
You have the time
Yes.
today? Great. I do have your profile here. Just let me confirm, Mrs. Nichols. What's your date of birth?
16th September 1959.
December 16th, 1959?
59, yeah.
Okay. And your address is on my profile here.
Yeah.
This is the one?
It's correct. Yeah. I have not moved.
All right. Can you tell me, Mrs. Nichols, do you have any allergies at all to medications?
No, I don't.
No
have any
allergies.
allergies.
And it looks like you take a few medications here, so I'm just going to read them out and you can tell me if that's still what you're using. Is that okay?
Yeah,
Okay.
sure.
So you're taking insulin so for diabetes?
Yes.
Okay. And you take the Lantus 15 units at bedtime. Is that still the same?
Yeah.
And the Aspart or Nova Rapid, you're using 5 units breakfast, lunch, and supper. That sounds the same. Nothing's changed there? No? Okay. You kind of hesitated there. Is it something might have changed? Or
Well, I just check sort of a few times.
Okay. We'll talk about that in a little bit then. So maybe not you getting the 5 units every time. Is that right? Okay. We'll talk about that then. And gabapentin, are you still taking that? 300 milligrams? That's for pain, is that?
Well, yeah, I have neuropathy in my
neuropathy.
feet, so my legs do a bit.
How long have you been having the neuropathy?
About 6 months.
6 months.
Yeah.
Okay. Moving on to other medications, your Ramipril, 5 milligrams, that's the same.
Yeah.
The Rosuvastatin for your cholesterol, that's
Yeah.
okay.
Yeah. That's all.
And you're taking aspirin daily?
Yes.
Great. You picked up 100 test strips 5 months ago. How's that going? Do you still have those test strips?
Yeah, I have a few left.
Okay. How often would you say you're checking your blood sugar then?
About 4 to 5 times a week.
4 to 5 times a week. And per week. So we've got the medications. Just going to medical history. I think we've covered a lot of it already. It looks like you have a history of high blood pressure.
Yes.
And you have diabetes. Is this type 1 diabetes?
Type 1.
Type 1. And the neuropathy and high cholesterol.
Yes.
And you're just on the. You've never had a stroke or heart attack or anything like
no.
that?
No. Well, my high blood pressure and cholesterol are well controlled.
Good.
Yeah.
Really good.
medication, so.
Wonderful. Any other medical problems or concerns that we haven't talked about that I might be missing?
No, I don't think so. No.
Okay. And I guess other medications. Do you take any herbals or over-the-counter
No, I don't.
medications? Nothing. Not even vitamins or anything like that.
No.
Just
No.
stick to this, eh?
Yeah.
Okay. All right. What about? I'm going to ask a few questions about social history, like things like alcohol and tobacco. Is that okay with you?
No, I don't. I don't actually smoke or drink.
You don't
So.
use tobacco products and you don't drink alcohol at all?
No.
Oh, well, good for you. That's obviously helpful to maintain some of our heart and healthy lifestyle, that's for sure. What about exercise?
No, I don't really do much of that.
Okay, that's fine. Would you say you get out and walk a little bit here and there?
Not a lot. At my work, of course, I do some.
Okay, yeah. And diet, are you getting a good diet?
Just a normal, good diet.
Would you say that you follow, do you know about the Canadian Food Guide?
Yeah.
Yeah.
Yeah. More or less, yeah.
You're following that regularly?
Yes.
Okay, good. Well, that's really good. Sounds like you're living a healthy lifestyle that way. Let's talk a little bit about the reason you came in. You mentioned that your foot is bothering you. Would it be okay if I had a look at that?
Yes.
Okay. Okay, so it looks like you've got a little bit of a cut there.
Yes.
Okay, and is it just on the one foot?
Yes,
Which
it's just on my right foot.
Right foot?
Yeah.
And when did that happen?
Well, I think it was 2 days ago. Yeah. I didn't actually notice it at the time. So.
Okay, yeah, you've mentioned you had the neuropathy. So
Yeah.
do you have trouble on a
I
scale
don't
of 10?
feel
How good of the feeling do you have?
I don't feel
Not much, eh? Okay. Is it pins and needles at all on a regular?
Oh, a little bit burning.
Burning?
And some sort of insensitivity
Mm-hmm.
kind of thing.
So most times you nick or cut your foot at all.
I
You
wouldn't
wouldn't even
notice.
notice, eh?
No.
Okay. Has your doctor or anybody else ever talked about foot care with you? And
No,
No.
not really. No.
okay, did they explain that you might run into problems with foot care, especially with your diabetes? And
My husband actually said that he had seen something
okay,
on TV that foot care is very important for
yeah.
diabetics. So
What did he
Yeah.
say about it?
he said that that the pharmacy probably would tell me
Good.
about foot care.
Yeah,
for
I can definitely
diabetics.
help out with that for you. A big concern is with any injuries to our feet, especially if you have neuropathy,
Mhm.
is that we can get infections. And
Well,
things
this is
like
what I'm scared of. Yeah, so
Mhm.
I really need something to prevent
Yeah.
getting infected.
So right now I'm a little worried right now, so I just want to ask you a few little more questions about this.
Mhm.
Do you notice any, it's going to be hard for you to sense pain, but is it any
Mhm.
worse than regular? Do you notice anything at all?
No, not really.
I notice it's a little red around the outside. Is that
Yeah,
new?
that's what my husband said. It's a little red, but it's not inflamed, but it's a little red.
Little red.
Red edge around it.
Okay.
Yeah.
And you started looking at it today, or is it 2 days ago when you first?
Well, I really didn't see it. My husband noticed it.
Okay.
Yeah,
And-
but now I've seen it. But I can't see it too clearly either because my eyesight isn't that
Oh, okay.
great.
Right. Do you think that? Does your husband think that it might be getting worse over the last few days?
He hasn't said anything.
And you haven't noticed, or have you noticed any oozing or
No.
nothing like that? Okay.
No.
Okay. I think what we need to do for now is dress that up for you, and I can help you with that. We'll pick up some products and make sure
Okay.
it's clean and dress it up, and
Yeah.
we can talk about some things about your foot care. What do you know already about foot care?
Well, I do change my socks every day and I wear shoes.
Okay.
It's really,
hmm
yeah.
So I'd like to talk to you a little bit about that, but I'm also wondering about you testing your blood sugars and how well they've been over the last little while.
Well, I've never heard back from my doctor or the endocrinologist, anything at all about my glucose readings. So I've always assumed that they're on target.
Okay.
Because nobody's ever.
Have you been going to see your doctor on a regular basis?
Well, fairly regular. I don't see him that often, no. But,
When was the last time you saw him?
It's a while ago, yeah.
Are we talking months, years,
No, probably months.
months, quite a few months?
Yeah.
And I don't
But
have,
he's
do I have
always
lab
been
results?
really happy with the readings. So,
Do you have any results, lab results?
yes, they are usually between 8 and 9.
8 or 9?
Yeah.
That's consistent when you take it?
Yeah.
Okay. And you don't know if you've had something called an A1C done, hemoglobin A1C, that doesn't ring a bell?
No.
So you're just testing your glucose regularly. And
Yeah.
You said you were doing it 2 times,
4 to 5 times a week.
4 to 5 times a week. And when you test it, would you say that it's consistently around that 8 or 9?
Yeah.
It's always there.
Yeah, it's always there.
And what do you think about that number?
Well, it's steady, so it's obviously on target. As I've never heard anything to the contrary.
Okay. So the doctor has never told you kind of what the target range we want to get to?
No, he's never complained about this either.
Okay.
He's just accepted the numbers.
hmm Okay, yeah, it's definitely. Would you like me to tell you a little bit about the numbers? Okay. So we do want to try to keep the glucose levels, what you're testing, to be around 4 to 7.
Oh.
But someone with type 1 diabetes for a long time, that can be hard to get to. So that you're pretty consistent at 8 is really not probably too bad. But if we have high levels for long periods, that can lead to problems like the neuropathy you have, and you mentioned eye problems you've been noticing as well.
Yes.
That can lead to problems. So we might be able to maybe try to get it a little lower, but as long as we're maintaining consistency, and that would be something we should look at. I guess, which would you rather talk about today, or I don't know if we'll have time to look at
Well,
this.
I am worried about the foot care, obviously.
So the foot care is your number one priority
Yeah.
today. Okay. What is how important do you think it is to take care of, on a scale of 1 to 10, 10 being we need to look at this right now, it's very important, or
I would say a 9.
a 9? So
Yeah.
very important to you to get this
Yes.
foot looked at. Okay. And how do you think down the road of taking care of your feet, if I help you out and we make some kind of suggestions, do you think that you could go ahead with those and take care of your feet?
I would certainly try very hard.
Okay.
Yeah.
Okay. So on a scale of 1 to 10 again, you'd say you'd be closer to the high end,
Yes. I would
confident
say
that you could take care of it. Okay.
Yes.
All right. Well, let's talk about that then a little bit. So like I said, we need to take care of this and cover it up and right now.
Right.
Do you know what some signs of worsening infection or anything like that are?
I assume it's oozing.
Yeah, good. So if it's got any oozing, if the reddening gets worse, if it starts to inflame, like you said, we need to go in and get it checked out right away. So we need to visit the doctor, okay, at that point. Because it could be an infection, we need to take care of that right away.
Right.
So if you notice any of that, how are you going to plan on checking your feet?
Well, that is a bit of a problem because my eyesight is not the best. So
Mhm.
it's kind of hard for me to. I suppose I could have my husband
Yeah.
sort of help.
Yeah, that's really good. You said you've had your husband look at your feet in the past. Is he
Yeah.
around regularly to help you with that?
Yes.
Do you think he would be willing to perform that role for you on a regular basis?
I think so.
Good. Yeah. I think that would be an excellent choice if he's around. And his eyesight is really good. Does he have any other medical problems that we should?
No.
Okay. So yeah, if you can help him out, I think together you can really make sure that things are looking good there. What about for maintenance? You talked about that you've heard about making sure you wear socks and shoes. And
Yes.
Is there anything else that you know about proper foot care?
No.
Okay. A couple of the things are you want to make sure that you're maintaining your cleanliness of your feet daily.
Mm-hmm.
So washing with mild soap and water and making sure it's dry afterwards.
Okay.
Okay, especially in between your toes, you want to make sure that that's dry. You also want to make sure you're clipping your toenails. Do you get a chance to do that often?
Well, yes, I do click that, but it is quite hard now.
It's hard, yeah.
Yeah.
Would he be able to help you with that as well?
Yeah, I'm not sure he would be that keen to that.
Okay. There is other resources too that people, home care kind of things can come in and help with that, but we can look into that later
Right.
if you're not comfortable with that.
Mhm.
Making sure you're not clicking into the cuticles is a big thing, so just straight across
Okay.
is good because we don't want to damage the sides.
No.
okay.
Right.
And then also lotion
Uh-huh.
daily, okay?
Okay.
And not between your toes, but just all over, just to keep your foot moist.
Oh, okay.
And changing your socks daily.
Yes, I do that.
Yeah.
Okay.
Do you think that we could potentially do that?
Mm-hmm. Yes.
So, just to make sure I've kind of explained myself good enough, do you think you could repeat back to me what you're going to do with your caring for your feet?
Yeah. Well, I think the important thing is to keep them clean and then put lotion on
Mhm.
and cut the nails properly,
Mm-hmm.
and then have my husband look for cuts or scrapes or whatever on a
Wonderful.
daily basis, I guess.
Wonderful.
Yeah, and wear fitting shoes.
Good. Those are all really good ideas. And I'm going to want to follow up on just to make sure that this looks good in a few days. If your husband notices anything like we talked about, that it might be an infection, we need to go in right away, though, okay? But
Okay.
I'd like to see you in a week and see how things are going with that. Does that sound
Yeah.
like a reasonable plan for you?
Yes, certainly.
Okay. And yeah, we can hopefully prevent any bad things from happening in that. And also we can talk about a few other things to help maintain your healthy lifestyle.
Okay,
Okay,
thank you.
great. Nice talking to you.
All right. So how did you feel about it?